Alert now and a warning from Oregon health officials after confirmed cases of measles just jumped from 2 to 3. They include an unvaccinated adult and child in Clackamas County and a third new case in Marion County. Alma McCarty's here with a look at the latest and what to look out for. Alma?
Well, David, we don't know much other than both people in Clackamas County live in the same household and were exposed to measles between May 19th and June 4th. Besides traveling to Marion County, health leaders say they haven't left the state, suggesting there may be other unreported measles cases in Oregon.
Measles has made its way to Oregon this year.
We have escaped so far, but it looks like our luck has run out.
And the airborne disease is putting health officials on high alert, like Dr. Paul Cieslak with the Oregon Health Authority.
Measles is one of the most highly contagious diseases known. And if you're in an area where somebody has measles and you are susceptible, you're not vaccinated, the odds are really high that you're going to get it.
He says given the drop in Oregon's vaccination rates in recent years, that ups the risk, especially for vulnerable populations.
My big fear is that it lands in a place where there's a high proportion of unvaccinated people. Most Oregonians are vaccinated and really have nothing to worry about from the disease. But, we've had some schools in Oregon where only 20% of the kids are vaccinated. And if measles were to land in a highly unvaccinated population, it would spread like wildfire before we were even aware that it was happening.
That's why OHA is getting the word out now after two people, an unvaccinated adult and child from Clackamas County, were exposed somewhere in Marion County. Both are recovering. OHA confirmed a third case in Marion County Monday evening.
If you've been exposed and you really think, for example, the case, and you're susceptible to the disease, then, we would want you to stay home for 21 days after your last exposure because you could come down with measles any day now.
OHA says early symptoms start showing up a week or two after exposure to the virus. Fever, muscle aches, nasal congestion, cough, and inflammation of the eyes. Then that rash begins a couple of days later, starting on the face and spreading to the rest of the body. Health leaders recommend calling your doctor and setting up an appointment to avoid exposing other people in a waiting room. David?
Yeah, no kidding. Thank you, Alma. Appreciate that report.